siya, okay? Hi sir, ako si Prince, trade procedure. Pwede po kumutabang nimo? Wala na siya. Okay? So, there are two types of choking there. We have partial airway obstruction and complete airway obstruction na siya. When we say partial, this patient can still talk na siya, can still breathe na siya, and also can still cough out sa kanang object na siya or kung unsa mo ganina na dislodge. So meaning, we will test first whether it's partial na siya. Sir, pwede ba nito maubo ang object? Maubo ba ka or dili? Dili na siya maubo. So meaning, it's already complete airway obstruction na siya. Because if the patient can still cough, then pwede yun na ma-dislodge or ma-remove ang object na siya. But if the patient can no longer cough na siya, meaning we will be the one to assist. We'll start first with the back blow. So how do we perform back blow na siya? So first is stand on the side of your patient na siya. Next one is one of your arms, it should be supporting the chest of your patient na siya. Then ask your patient to lean forward na siya. Then after that one, in between, okay, in between sa shoulder blades sa inyo patient, that is where you are going to perform back blow na siya. By using the palm of your hands na siya, so hapak yun mo. Okay? But during the assessment, you don't need to hapak na kusog yun kayo. Okay, ipakita lang na assessor na you are going to perform back blow. And, storya po mo, ma'am, when I'm performing back blow, I'm also looking at the mouth of the patient. Okay, look if na-dislodge ba object or wala pa na siya. Gets ninyo? Alright, okay. Aside from back blow, we have abdominal thrust or also known as Heimlich maneuver na siya. This is one of the most, actually, this is the most effective in management in choking na siya. So first is you are going to stand at the back of your patient na siya. Then one of your foot should be in between sa foot sa inyong patient. Then you have to ask your patient to lean backward padung sa inyong lawas na siya. Why? Because if the patient turns unconscious na siya, at least the patient is naman nato nakasandig. Okay? Because if the patient will lean forward na siya, and what if the patient turns unconscious, di na tumasaw na yun. But if naka-lean backward na siya, nakasandig sa tuwa, okay kay na siya. Okay? Next one is locate the button of the pants of your patient na siya by tracing the belt line na siya. Okay? So once we locate the button of the pants na siya, just above that one is your knee belt or pusod ni patient. Okay? Nakita nila po ang pusod na niya. And 2 inch above sa pusod ni patient, that is where we will perform abdominal thrust na siya. Gets niyo? So how do we perform abdominal thrust? So one of your dominant hands, ang inyong thumb, and is inyo na siyang i-flat. Okay? Then the other hand will be support na niya. Okay? So all you have to do is, if butang na niyo 2 inch above sa iyang pusod or knee belt, then you are going to do a scooping motion na siya. Or letter G ang inyong buhaton na niya. Gets niyo? Okay. Now, why do we need to perform this one? This will actually help, na mo suka na si patient. Okay? Okay na may example ta? Man? Sure ka? Dili ka practice? Mata na lang po. Okay? Alright, so for example, count of 3. 1, 2. Okay? The patient can actually feel na mo kabante ka na mo suka ka. Okay? Mo attempt na siya suka, which really helps dislodge the objects na siya. Okay? Now, other options for this one is we have chest thrust na siya, no? For the chest thrust, okay, it's commonly used if in case you have a pregnant na patient or dako na kayo inyong patient. When we say dako na kayo inyong patient, what if di na po makapot, no? So, other options for that one is chest thrust na siya. All you have to do, insert your arms in the armpit of your patient, same position, yapon sa inyong kamot, butang diri sa chest, automatic na siya. You don't need to do 2 inch, diretso na gina sa chest. Then, all you have to do is inward ang inyong hampag at chest thrust na niya. Okay? This is very common for obese patient or pregnant na mga patient. Okay? Now, for options at katulog is pasandig sa wall. No, or that's another option para siya. Pero